Salam, hello everyone, I'm Dr. Asad Saleem and welcome to my YouTube channel at Asad Saleem 1414. Today we'll be discussing migraine, a common neurological disorder that affects millions of people worldwide. Migraine is a type of headache disorder characterized by recurrent episodes of severe headaches, often accompanied by sensitivity to light, sound, and nausea. Migraine with aura, a type of migraine where patients experience neurological symptoms, such as flashing lights or numbness, before the headache begins. Migraine without aura, a type of migraine where patients do not experience neurological symptoms before the headache begins. Chronic migraine, a type of migraine where patients experience headaches on 15 or more days per month. Headache, a severe throbbing or pulsating headache often on one side of the head. Sensitivity to light and sound. Patients may experience increased sensitivity to light and sound during a migraine episode. Nausea and vomiting. Patients may experience nausea and vomiting during a migraine episode. Aura. Some patients may experience neurological symptoms such as flashing lights or numbness before the headache begins. A migraine headache can be severe and debilitating. Patients may experience increased sensitivity to light during a migraine episode. They may also have increased sensitivity to sound. Additionally, nausea and vomiting are common symptoms during a migraine episode. Migraine can run in families, suggesting a genetic component. Hormonal fluctuations, such as those experienced during menstruation or menopause, can trigger migraine episodes. Stress is a common trigger for migraine episodes. Changes in sleep patterns or sleep disorders can also trigger migraine episodes. A thorough medical history is essential for diagnosing migraine. A physical examination may be performed to rule out other potential causes of headaches. Imaging tests such as MRI or CT scans may be ordered to rule out other potential causes of headaches. Acute treatments. Medications such as triptans or NSAIDs may be prescribed to treat migraine episodes. Preventive treatments. Medications such as beta blockers or anticonvulsants may be prescribed to prevent migraine episodes. Lifestyle changes. Patients may be advised to make lifestyle changes, such as avoiding triggers, getting regular exercise, and practicing stress-reducing techniques. Avoid trigger foods. Patients may be advised to avoid foods that trigger migraine episodes, such as chocolate or citrus fruits. Stay hydrated. Patients may be advised to drink plenty of water to stay hydrated. Maintain a food diary. Patients may be advised to keep a food diary to track potential trigger foods. Migraine is a complex and debilitating disorder that can significantly impact a patient's quality of life. By understanding the types, clinical features, and triggers of migraine, patients can work with their healthcare providers to develop effective treatment plans and make lifestyle changes to manage their symptoms. If you have any questions or comments, please leave them in the comment section below. Don't forget to subscribe to my channel at Asad Saleem 1414 for more medical insights and share this video with others who may find it helpful.